Welcome to the Practice X Factor, the place to be for mastering membership plans for your business. Here, you'll learn exactly how to grow your patient relationships and accelerate your profits without getting stuck on the dental insurance bandwagon.
Hey, thanks for joining us on another episode of the Practice X Factor. I'd like to welcome you back and love to hear from you, your comments and feedback on this episode. That helps us with the content of future episodes, and it's a lot of fun from us to hear from you and your practice and how things are going and what's working for you and what isn't. That's how progress is made, by making mistakes and failing and trial and error sometimes. So today we're talking about AI, which is a big buzzword, but specifically about AI and diagnosing and creating your treatment plans. So for us in our practice, we call it a MAP. We use an acronym of MAPS, M-A-P-S-S. That's what we have developed for creating a plan, because I think of a treatment plan as really more of a long-term map than it is a one-time plan. And so when you think of the conventional way that we're taught in dental school, a lot of treatment plans, what might be to remove a tooth or to prep a tooth or to do an implant or to treat gum disease, something like that. But to me, that's never been the answer. That's just a solution that is kind of static or one point in time. So I like to think broader and bigger about oral systemic health and how can I help this person in other ways besides just their mouth or that one tooth, especially because I think that's limiting. And it's interesting, when you wear loupes, you really get zoomed in on those one or two teeth, which is good during the procedure. But I think sometimes we focus too much on a single tooth without looking at the big picture. For example, a patient with a cracked tooth that hurts, if we don't do some observation and figure out if there's a bruxism issue or if there's a malocclusion issue, then fixing the tooth really won't fix the problem. It's just a temporary fix. So one area that's been really interesting for me, and maybe for you as well, is AI. And I kind of laugh at the buzzword AI because when I was in middle school, one of my neighbors worked for this company called WordPerfect, and they're not around anymore. But if you grew up in the 90s, you may have remembered typing some of your school assignments on WordPerfect. And it was essentially before Microsoft Word, but it was a word processor and it was pre-internet, but you would type things on it, type your papers and save them. And if you didn't save them and you shut the computer down, you would lose it. We didn't have the auto-save feature like we do now. Updates came when you had a new disk sent to you and you'd have to put it in there and update it. But I helped my dad at his office with some different projects. And so I got to know a little bit about word processing and how that worked. And when I look back at that WordPerfect, really that was AI, right? They had spell check built into it. Spell check is really an AI. So when you think about what people like to refer to as AI right now, it's really not new. It's just kind of the buzzword that's caught some more attention. And if you talk to people who work for you, or if you're part of a practice and you're not an owner, maybe some of your coworkers, a lot of them may be intimidated or feel threatened by AI because they think that it might replace their jobs. And I do think that's true to some point. However, a lot of the research now is saying that white collar jobs are maybe the most threatened by AI, but blue collar jobs are less threatened. And I think of dentistry really as more of a blue collar job than a white collar job. I know we wear a white coat and we go to professional school, and I'm not taking away anything from that. But I think of, some of my favorite patients and favorite friends are more the blue collar type, where they don't mind getting their hands dirty. They work on projects, they build things, they put things together. And really that's what we're doing in dentistry, is we're creating smiles and creating health. And I think jobs like that are less likely. Welding, for example, is a lot less likely to be replaced by AI than a bookkeeper or an accountant, where a lot of those things can be done automatically. And I wanted to reference a study from an article that I was reading from the Journal of American Medicine. And the quote was how AI could impact your local doctor visit. And it said that a new study reveals that large language models outperform physicians in diagnostic accuracy, but require strategic integration to enhance clinical decision-making without replacing human expertise. In a recent study published in JAMA Network Open, researchers investigate whether large language models, LLMs, could enhance the diagnostic reasoning of physicians as compared to using standard diagnostic resources. LLMs, large language models, were found to perform better alone as compared to the performance of physician groups using LLMs for diagnostic cases. The standalone performance of the large language model was better than that of both human groups, with these results similar to those published in similar studies on other LLMs, is attributed to the sensitivity to prompt formulation, which emphasizes the importance of prompt strategies in maximizing the utility of LLMs. So I think that what the future of AI is it's going to be like another person working in your practice rather than somebody replacing you. We're using AI a lot with some of our calendar and personal assistant tasks in the office and in our businesses. And recently we started using an AI for our x-rays, and maybe you've tried out some of these. There are a few different ones. Pearl is the one that we're currently using, and I don't have any financial interest in Pearl. It's just one that integrated with our practice management software very easily. And I did a demo of it, and I was pretty impressed. So I've been using it now for probably 4 months, and it's amazing how much more treatment it's opened us up to and how much more involved we can get the patient. I think from an education and awareness standpoint of helping the patient see the problem, it's huge. But also, it finds a lot of things like bone loss and interproximal decay and open margins specifically, and calculus. That's the other one. So those are the 4 that we see a lot with AI is calculus, subgingival calculus, open margins, interproximal decay, and bone loss that you don't always catch on an x-ray. We also, a 5th area that we don't use it quite as often for, but has been pretty helpful, is finding radiolucencies. So it's not always perfect. Sometimes I found it misdiagnoses. We've seen some teeth that are virgin teeth, no issues, no symptoms, and it'll show radiolucency, and it might just be developmental or the angle of the x-ray. But I would say about 90% of the time, I trust it now. And it's really having a second set of eyes on your x-rays. And that's how I look at it, is I take my assessment and the assessment of the AI and combine those two. And if only one of us sees it, then it might be a little more further investigations needed, maybe some different angles with the x-rays. But the comprehensive treatment has been so great that I think the technology pays for itself very quickly. But also, what I love the most is it empowers your team to find problems, right? So although assistants and hygienists can't diagnose, they should definitely be educating, and they should definitely be flagging areas and letting the patients know that they're concerned and they want the doctor to look at that. So if you haven't tried out any of these softwares, I would encourage you to demo a couple of them and see what you think, see how it fit in your practice. I think it's going to be a big part of the future of dentistry. Another one that's come up a few times is there are some robotic AI equipment now that can do things like even place implants. And I've had some interaction with one of the reps in our area, and I'm not too interested in getting in on the first generation as far as the cost versus benefit analysis, but I'm very open to the concept. I think it's something that's going to progress, just like when CEREC and CAD/CAM was new, so many people didn't want to embrace it, and now almost no practice doesn't embrace it. So really it's a matter of time before cost comes down, acceptance becomes more mainstream, and the technology improves. And if you look at intraoral scanners now, from what I've learned and gathered from some of the reps, is the technology in the scanner itself really isn't improving that much more. It's kind of plateaued to how far it can go. The main thing that needs to be updated is the software on the computer and replacement sometimes of your laptop. But the scanners, there really isn't a lot more upside to them from what I've heard in the industry. So I think that's where some of this excitement to AI shifts. And I think that we need to be careful not to get too excited about it. But at the same time, I love that AI is not biased, right? It's easy to listen to your patient and get bias on not wanting to tell them and underdiagnosing what's going on. At the same time, we have to be careful not to overdiagnose, and especially not to intimidate your patient and tell them that they have 15 cavities that need to be fixed tomorrow when they're having no symptoms and they haven't had a cavity in 10 years, right? And so it's how you approach that. And for us, that's really our MAPS process, is staging out things based on level of importance and then taking it at a pace that our patient's comfortable with. So I would never suggest you underdiagnose, but I would always suggest that you don't pressure patient into doing anything. Studies will say as much as 39%, or as low as 39% rather, of tooth decay is treated. And so to me, no matter where you live, if it's a dense area or not, there is so much tooth decay that goes untreated that there's no reason to pressure anyone or make up treatment. However, it is important that we get our team on board with this technology and that we take advantage of what it can do for us and how it can make our lives easier, and that you can get back to doing the dentistry you love. So we are looking at having some of these AI companies on future podcasts. So if there are some specifics that you'd like us to interview, please reach out to us. Our contact information is inside the podcast, and we would be happy to hear from you and see what your thoughts are. If you have any feedback on AI that you've used, that you hated, loved, or anything in between, please let me know. And we really appreciate your thoughts and support of the podcast. So have a wonderful day, and we'll talk to you soon. Thanks.
For more tools and tips on how to create an X Factor membership practice, visit yourpracticegrowth.com and subscribe to our free weekly email today.